It's almost 1. I'll be here Tuesdays and Fridays for you, excuse me, between 12:30 and 1:30. And it's my pleasure to be here. And Medical Jobs Channel is coming to you on Facebook Live right now. We're also on YouTube and Instagram, and our tech department is working on some live chat that we can do. So I'm excited about that. That will be coming soon, so we can interact a little more. But you can go to Facebook, go to YouTube. Employers, healthcare, we're all about healthcare. Healthcare employers are recruiting on Facebook through Medical Jobs Channel. So there are jobs there for you to find, and employees, nurses, respiratory therapist, physical therapist, techs, radiology techs, surgical techs, emergency medical techs, CNAs, LVNs, medical assistants. We are a healthcare channel, and we are all about people finding the right employee and employees finding their next best job. And we talked about last time I broadcast on Tuesday, we talked a lot about changes, and we've been changed by the coronavirus, and change is always good. I knew a nurse, gosh, she was fabulous. She taught me about lots and lots of tips for IV insertion, and she taught me about PICC line insertion, PICC PICC, percutaneous catheterization. I don't know. You know, it's a very, very special procedure that both doctors and nurses do. And the department I was working in was interventional radiology. So a lot of the nurses in that department, a few of the nurses in ER, and some other areas in bigger hospitals, maybe part of the IV team, were required or encouraged to become PICC certified. So it was PICC, and I got some training from her, which I'll never forget. She was a fabulous nurse, but I always digress. The reason I mention her is, as fabulous as she was at education, and she wasn't really our educator, she was just one of the, what do I want to say? She had tenure in the department, but she was a good educator. But she told me that she changed her job every 5 years. It was just a plan she had. She sometimes would change within the hospital, but it was a principle of hers, and that's what she did every 5 years. It's just like some people move frequently. Not my style. I stay places for a long time. My work is often my home away from home, and but it was interesting. And I think in these times of great change and great need in healthcare, that it's good to be prepared, and it's good to sometimes come out of your comfort zone, which we would have to do if we were, say, somewhere for quite some time. Maybe you were an orthopedic nurse for quite some time, or maybe you were a recovery room nurse for quite some time, or maybe you were a clinic nurse for some time, and you decide, you know, I really want to get into the acute setting. Or maybe you are just ready for a change, you know. So you may work in a huge facility and want to come more into a community setting and so forth. Oh, so sorry about that. I normally turn that sound down on my phone. I apologize. Let's get it down now if I can. Well, it's not being cooperative. Let's see. Hang on there, folks. Sorry, terrible airtime here. Okay, turn that sound down. So for whatever reason, since we're here for both employers and employees, I thought it'd be a good idea to talk about some tips on interviewing. Okay, so I'm trying something. Let's see, let me get it in the right order. Okay, so I'm trying, I'm going to use some cue cards because I always sort of get in a conversation here and then I digress, and I want to stay on topic for you. It's Friday. I don't want to waste your time. Getting myself organized here. I just took a long walk with my new grandbaby and didn't have a chance to freshen up. So clean things up here. Okay, so I'm going to try using some cue cards to keep me on track for you. And again, my name is Rita. This is Medical Jobs Channel. We were formerly Gold Medical Jobs. Same concern, just a little bit newer and better and moving on in the tech side of things. So hopefully we can have some interactive. You can email me anytime. It's coming across the screen. It's Rita@medicaljobschannel.com. And so today we're talking about tips for interviews. So, I mean, again, I'm giving you 3. There could easily be 30 or more. So here's the first one. Be quiet. People need to tell me that sometimes. What I mean by be quiet is don't be a chatterbox. Don't go on and on. Take a breath. Listen to the question. We are often nervous. We're meeting new people. We're maybe going into something that's a little different. Maybe we're a new grad RN. Maybe we are new to the area. A lot of travelers come into an area, they visit Hawaii, and I think they think, wow, this travel assignment is ending, but I don't want to go back to my cold state or whatever. And so they interview at either the hospital they worked at or whatever brings you to an interview. Take a deep breath and listen. Be a good listener. I don't mean to be silent through the whole interview because you will be answering questions. So what happens when you're not quiet? When you're chattering, you may even be interrupting your interviewer, is that you seem to be unsure of yourself. You're letting your nervousness show. So not a good plan. Also, it tells the interviewer who may be a seasoned interviewer. I did a lot of interviewing in my career for my company and other companies, and I would be concerned when people would tell run-on sentences, and I might even preface the interview with, so we have about 15, 20 minutes here, and I have some questions for you, and I will give you time towards the end of our interview for you to ask me questions. So I would set up the interview so they knew time was limited. And I always wear a watch. Well, actually not wearing a watch today, but I almost always wore a watch for the many years. Nurses wear watches. And but I often would have a clock on the wall across behind the interviewee so that I could check, so I wasn't looking at my watch and making them more nervous if they were already nervous. So when people kind of went on and maybe got into personal stories that had nothing to do with their clinical abilities and their healthcare knowledge, it made me think they were unsure of themselves and that they wanted to deter from the questions being asked about their skills and knowledge. And so it isn't good. It also showed me sometimes that their thoughts weren't organized. I might ask a question about, oh, tell me at least 3 of the top skills that you utilized in your previous position. And they may not have even mentioned one, They might have just started talking about that job and what went on there, the good, the bad, the ugly, and that was not a good mark in an interview. Being quiet tells the interviewer that you're demonstrating maturity and confidence enough to deal with pressure appropriately, because sometimes difficult questions come up in an interview. What would you do if you were in a position and the equipment you were using failed and your patient was in distress? I mean, that's a difficult question. First of all, you have to think about when and where that happened and what your part was in it. If you're a doctor, your part in it's different than if you're an orderly, if you're the respiratory therapist, during a procedure. So number one, know when to be quiet, okay? Not silent, just thoughtful. Process the questions, answer the questions, and know when to stop, okay? So the second, I have my little cue card here. Get straight. Can you see that? I think so. Mind your manners. Your grandma, if you're lucky enough to have a grandma, she probably told you that. Get your elbows off the table, sit up straight, look people in the eye when you shake their hand, right? Okay, so part of good manners is to avoid being rude. So this is something I really have to work on. My husband gets very upset with me when he's telling a story, and I was there because we've been together forever. Don't interrupt. So if your interviewer pauses, that doesn't mean jump in. So be very, very careful to be a good listener and don't interrupt. Mind your manners, okay? Here's another one. When you come into the office, there may be somebody at the front desk. There may or may not be a receptionist. You may come in and there's a front desk and somebody's on the phone. Don't interrupt them. You may see a paper that says, if you're here for an interview, sign in. Whatever. Be nice to those people. Don't be rude. Don't interrupt people on the phone. Don't repeatedly knock on doors. Arrive on time. Not too early. That's distressing. If you're like 30, 40 minutes early and you have a 10 o'clock appointment and you get there at 9:05, good grief. What are you doing there? People are working. So 10 or 15 minutes is always fine. More than that is also rude. Here's another thing. Mind your manners. What were the first words you thought you learned after mama and dada? Please and thank you. Okay? So I don't know when please would come up, but it's always a good word and use it appropriately. But thank you. Shaking hands. So when you meet your interviewer, of course now after Corona, I don't know when we'll be shaking hands again, but yeah, the COVID-19 has made us, I wear gloves wherever I go. I throw them out as soon as I'm done shopping, visiting, whatever. So yeah, it's a lot of virtual stuff right now. If we ever get back to shaking hands, it's always a good idea when you greet someone to look them in the eye and shake their hand. We may start doing that with gloves on. That wouldn't be the worst thing in the world. When you leave your interview, remember not to touch your face with those gloves. Keep, Kleenex handy or whatever you need if you have to touch your face. I often have to touch my face because I get itchy for some reason. But stand, look people in the eye, greet them. Be pleasant, don't be a frowny face, don't be a Debbie Downer, and thank them. When the interview is done, whether it's a 10-minute interview, an hour interview, 30-minute interview, at the conclusion, you want to say thank you. They took their time to spend with you and learn about you. So be grateful and say thank you. And guess what? It's still okay to send a thank you note. Many people that I hired and many people that I didn't hire immediately left the interview, probably had the thank you note in their car, in their pocket, in their purse, and sent a thank you note. email, if your interviewer has provided an email, a thank you email is wonderful. Subject matter, thank you. The email is short but pleasant. Dear Mr. or Miss or Ms. So-and-so, thank you very much for spending the time to interview me today. I look forward to speaking with you at your earliest convenience. Thank you very much. Or just thank you. Thank you for the interview today, period. And sign your name. Okay, so that's number 2, mind your manners. This is so basic, but you know, it's good stuff. Number 3, and I said 3+ because I do have a bonus for you. Be prepared. Got that? Be prepared. Be prepared, folks. So what does be prepared mean? It certainly means that if you have questions about the job, say you're applying for to a surgical clinic, right? And your position, you're applying for a PACU nurse. So you may want to know, does that include pre-op, post-op? Will you ever go into the OR? Does it mean scheduling? I mean, it just depends. Every facility is different. Some nurses just work the pre-op area, right? They just prep the patients. Some nurses do assist in the OR. Some nurses, you know, so have your questions ready, okay? And usually not a good time, particularly nowadays, there are often more than one interview. You may have to meet with an HR manager. You may have to meet with a department head. You may meet with your nursing supervisor, or, you know, if it's the head of radiology, you may have to work, you may have a meeting with sometimes you'll have more than one people in your interview, which can make you nervous. Breathe, be quiet, pay attention and listen. Back to number 1. But to be prepared, you should have some idea of what you need to know. And it may come up during the interview. So be polite. Is that mind your manners? Okay, so politely ask, if it looks like the interview is drawing to a close, would you mind, do you have time for me to ask you a few questions? I mean, a good interviewer will usually allow time for that because you're both trying to figure out if it's a good fit, right? You know, culture is as important as the work. So, so have those questions you're about the job and the position lined up in your head. You know, maybe think about it the day before, the night before, or, you know, if you know that you have, you know, panic times and so forth, have some notes. You can bring out your little notebook. That's fine. After the interview, you're going to be paying strong attention. But if you're allowed time to ask some questions and you have 2 or 3 questions, you can jot them down. Yeah, that's okay. Also, do some research. Be prepared. Do some research. If this is, let's just use the same, you know, a PACU, a recovery room nurse. She has worked in another state, and she came here as a traveler. She's been here for 2 assignments, and they don't need her in the department where she was because somebody was recovering from whatever, some surgery or whatever, and so that department is fully staffed, but they have a same-day surgery. So they're asked, you know, she thought, well, let me apply for that job. So find out what you can about that department, about that facility. If it's part of, say, a big like Kaiser, for example, or maybe a big medical center, you know, back east. I'm trying to think of one. I know Connecticut has the Harvard Medical Center. They have several hospitals and campuses that all do slightly different things. So do your research. Know, you know, you can compliment. Say, I'm really eager to stay here. I was a traveler here for the last 6 months, and everybody seems so content with their positions. The patients leave happy. I like the process. I like that we follow up with our cases. You know, do your research and know what you're looking at when you're at a clinic or a hospital or whatever, the department, the facility, long-term, a lot of the long-term facilities are parts of corporations. So they may be throughout the state you're living in. They may be throughout the United States. So it's good to know. It's good to know for you too, you know, what you're getting into. So number 3, be prepared. So that's it. Those are 3 of my fabulous interviewing tips. And I come to you from being on both sides of that table, being an interviewer and being an interviewee. Because, you know, I've been around for a few years, so I've had jobs since I was 14 years old, and I'm way past that. So here's my bonus. A bonus tip. Show your uniqueness. Show that you're unique. How can you do that? You want to be remembered, right? So in your preparing, have, you know, if they ask you, tell me one of your best qualities and tell me where you might be lacking, things that you're working on. It's okay. We're not perfect. So, you know, you don't want to be lacking in the skills they're looking for. If you're a PACU nurse, you know, your charting has to be good. Your experience has to be good. If you're a newer grad and you don't have experience to fall back on, you could talk about the experiences you had in your clinic experience as a student. You know, even though you were being supervised, you had experiences. So you do want to set yourself apart. So here's the thing. This has happened to me mostly when I interview people. I get a resume, or they bring me a resume at the first interview. And I think, oh my goodness, I hope this person isn't overqualified for this job in the PACU, because, you know, he's been at a university hospital. He's been part of the IV team. He did some flight nursing. He has his master's, or he's, you know, practically a nurse practitioner. I mean, so I'm looking on paper at somebody that looks superbly qualified, 10 years, recent PACU experience, works pre-op, post-op, some OR experience. On his days off, he does blah, blah, blah. So I'm looking at this resume that is stellar, but doesn't match up with the person that walked into my office, you know, in flip-flops and unkempt, and didn't look me in the eye, didn't greet me, didn't impress me. So you want to go to your interview well rested, in good spirits, full of confidence, not braggy, but confident, and set yourself apart. And if somebody asks, I'm interviewing all day today and all day tomorrow for one position, so you already know you're in a lineup, and they say to you, why do you think I should hire you? You should have an answer for that. Even if it's simple things like, you know, I'm always punctual. I know a lot about the position, but I'm not afraid to ask questions. You know, something that will set you apart, okay? So you want to be remembered when you leave that interview. So that's my bonus question that I add to my fabulous tips. You need to show that you're unique in an interview, okay? So folks, I always go on and on. How long have I chewed your ear off? I'm pushing the 30-minute mark. Medical Jobs channel is for anybody in the healthcare world, anybody who needs healthcare employees. I've been a nurse for many, many years, since the 70s, and I have a lot of experience as a clinical nurse, as a nursing administrator, as a clinical supervisor. I worked at a lot of different departments. I love being a nurse. I really feel when my mom had a stroke a few years back, that when my dad, many years before that, got ill, that I appreciated my role and the knowledge I had, that they really helped me to get to that point in my life to be helpful to my parents. And so nursing has been a great career for me. Part of what I did was I employed a lot of nurses for per diem and travel assignments. And so interviewing is a huge part of my life. And so I want to help others. And I want you to be able to find a great job or find a great employee. And that is what Medical Jobs Channel is there for. It's a unique way. It's not recruitment. It's finding each other, because you're both there at our channel, on Facebook, on Instagram, on YouTube. So, so here, I think, oh, it got erased a little bit. Let me fix it up. Oh, I got to put pun back in there. Let me use my I'm not so prepared with my my marker boards here, because the boards are okay, but my markers are dying. So usually when I come on the video here, okay, that's not too bad. I think that's legible. I smudged it. It's probably all over my clothes. Okay, so the key word here is kleptomania, right? So a lot of times when I come on these videos, I will have a Q&A, which I give you some time to answer, and then I give you the answer, because what's more frustrating than somebody throwing a puzzle or a question at you and not verifying the correct answer? So I'm not going to do that. But today I thought, it's Friday, let's be light. We've all been sequestered or sick or something with this pandemic, and I hope I'm speaking to a lot of well people. If you're not, I hope you get well. So I thought I'd start adding a pun of the week on Fridays, and I'll do my Q&A. I'll do the more serious stuff on Tuesdays. Okay, then I'll give you you know, a quick lab question or a quick math calculation or drug question, whatever, all the things that we deal with. Let me see, get my face and my question in there. Okay, so the pun of the week begins off with, when my kleptomania gets really bad, I take something for it. Okay, corny. You know, do the best I can. I'm a nurse, you know, I'm not a comedian. All right, folks, have a beautiful Friday. Please email me. I set up my email a week ago, and I haven't heard from anybody, but I know that's an old-fashioned way to do things. I don't do the TikTok. I do very little on Instagram, but Facebook, you can find Medical Jobs Channel on Facebook if you want to write some questions, likes, dislikes, whatever. The good, the bad, the ugly. We're here for it all. And if you have topics that you'd like to talk about, anything in the healthcare world, I am happy to talk about. And a lot of times I have guests on. I've had my friend Mary, who is a wonderful nurse who started a wellness business just before this COVID. So she's doing a lot of virtual things. And hopefully when we're able to, she can get back to her live coaching. She does a lot of coaching, and she's certified in healthcare coaching and all kinds of things, energy work, and she works with some fabulous people like ex-military people and Reiki masters and massage therapists, acupuncturists. So lots and lots of great things for another whole avenue of lifestyle and wellness nursing and healthcare. So she has been a great guest on our show and has shared with us a lot. So hopefully next week we can have Mary here. And I will do my best to recruit other nursing students, nursing grads, anyone and everyone, so you don't get too bored with me. But there's a lot of knowledgeable people out there, and it's good to share. It's really good to share. And I hope that I've been helpful to you, and I hope I hear from you. So have a beautiful weekend, mid-May, and I'll talk to you on Tuesday. Thank you.